which will lead to. So what I mean to say now, I will come towards the exam. I will tell you that this I have passed in the second attempt, and it for me the first attempt was not also difficult. The exam is really doable, and if we are in a tunnel, don't spread yourself, don't spread your preparation. Don't focus only on applied clinical knowledge like guidelines, like applied clinical knowledge you can grab in the last weeks. Just few guidelines you can go through with the recommendations, and that's all you need is the communication, is the patient centered approach, and is the focus on domains are really important. If you will communicate well, you will cover the patient safety, you will cover the information gathering, you will cover the communication with the colleagues, and what left is only applied clinical knowledge. So applied clinical knowledge you can cover by doing all those domains. Okay. And the second thing I will focus on, that always trust in yourself. You are not lesser than anyone. Everyone is really very good knowledgeable in terms of applied clinical knowledge. Only thing that you need to focus on communication. This is what I did in my second attempt. In my first attempt I did well in communication, but there was time management. I could not manage time in few stations. This time also I could not manage time, and I was scared because my all stations were like left. I did not complete the stations. But the thing is that I was patient centered. I go along with the patient, and I think that's the reason I made it. Okay, and few more things I want to tell you. If you have any questions, that would be easy, because your questions, your thought processes must be different from me. What I did, maybe you are thinking in different ways. So you can ask questions, and I will love to answer those questions. Then I want to tell you the journey of this group. I have attended few courses before as well. Then in the end, I attended this course as well, and this course really helped me. I have grabbed all of my applied clinical knowledge, and then whatever the deficiencies, I was like, I kept asking Dr. Huma, Dr. Ruhi, Dr. Fawzia, like, here and there, and they were really helpful and supportive. So it was just gathering the applied clinical knowledge in the last. I was been focusing on my communication myself, like for like past 2 years. It's couple of years you are getting this exam, right? So just focus on your communication, time management, scale your time, like for the 10 minutes, put a timer, start and do, and then record, and then listen yourself, that how do you talk to a patient. Don't go with the template. Information gathering, don't go with the template. Go with the patient. Focused questions, relevant questions. Don't ask everything. Everything is not desired in any station or every station. Okay, I'm a bit fast. Now I will give you just few things which are new in this exam. So this exam is now, I have seen that more on medical points, like they have brought comorbidities in every patient. There is more kind of medical and general supportive surgical management. It's not only related to OBGYN anymore. I feel patients are different. Post-operative management is quite wide. You need to have a comprehensive approach towards the post-operative management, towards the comorbidities of the patients, benign gynae modules. These all, they will show up with some comorbidities. So it's not that you will have a tunnel vision only for the OBGYN. Think broadly. If some comorbidity is presented, just focus on that. If patient is presenting some surgical complications, some personal problems, some psychosocial problems, you need to cover those. And this is what I did. I did not complete my applied clinical knowledge related to that topic, but and that's the reason I was really scared, and I was thinking that this time also I could not be able to finish timely, and I did not apply clinical knowledge. But the thing is that I went through the patient perspectives, so I think this was easier to do with. So you can ask questions, and then maybe I will help you out. Thank you.
Anybody has any question for Sabeen? Please come forward.
Hello, Dr. Sabeen.
Kanchana has to leave. So
after Sabeen, Kanchana wants to share her views. Okay.
Okay.
Hello, can I speak?
Yeah.
Yes.
Yeah, hello. Great, congratulations for your success.
Thank you.
Actually, I wanted to ask particularly for labor ward prioritization. How did you prepare yourself, and how did you go ahead in the exam for labor ward prioritization?
Okay, so last time when I gave it first time, I did not do labor ward prioritization. I could not complete it. Like even in first and 2 stations, it was just finished and my time was over and I did not complete it. This time I attended mock with Dr. Fozia. It was really helpful. And then I prepared it a lot every day, twice a day, morning and evening. I was doing one labor ward. You have to go in the labor ward. You have to show your skills. It's not applied clinical knowledge. Imagine yourself that you are having these patients, go with the SBAR. It is very important. Give a brief signpost. Signposting for everything is very important. Signpost for information gathering, signpost for information sharing. So signpost initially that this is the, don't be bothered that you could not complete and you did not read all cases. No need. You will go along room by room, and room by room try to identify risk factors. See, we are specialists. We don't need to take full history examination. Just find risk factors and pick those risk factors and tell her those risk factors. And in the SBAR mode, and the second thing, very important in the labor board, you need to talk about the forward planning. Like if you have seen a patient with preeclampsia or you have seen a patient with PPH, you need to talk forward. Like I will admit this patient in high dependency unit. PPH, I will talk to patient. After patient will be stable, I will debrief the patient. I will take care about her post-traumatic stress disorder. I will go talk to her family. Just imagine yourself in the ward you are standing and these patients, and what do you do after? You will not leave patient here in the labor ward. So it's your responsibility to take it from the beginning and then go afterward. They want to see your skills. They want to see your forward planning. They want to see your non-technical skills also. You need, you cannot do alone. That's very, very important. Don't say everything I, okay, you will do, but you need a team. So always talk about the team. In the post-operative, in emergencies, in labor ward, in gynae ward, you are not alone. You have a team. So talk about your team. I will take midwife, I will take anesthetist, I will ask SHO, I will take any junior trainee, midwives. So did you know this? Although no matter if you cannot complete a station, no matter if you will not complete all 10 or given the stations, but if every case you will go risk factor, identify risk factor, go with the SBAR, talk about at the moment what you will do, and then keep in your mind forward planning. For every case, you need to say something. If there is some medications, talk about the side effects, talk about the toxicity, talk about the contraindications. So this is all labor ward. And then if there is CTG, just describe CTG well. And I will encourage you to take mocks in the end. And mocks will really help, would be helpful to you. And whatever the recalls, this time I did all recalls with Dr. Ruhi and Dr. Fozia and Dr. Huma, and those really helped us because, of course, recalls will not come as such in the exam. But you will have an idea, and then you can modify that when you will be in the performance. Don't forget SBAR in labor ward. SBAR, forward planning, and show your skills, show your communication skills, your non-technical skills, and that's all. Yeah, and show up your teamwork. Okay, show up your teamwork. Like I will go along with my team.
Any other question? If there's no question,
Yes, actually,
move towards Kanchana. Okay, please.
I'm so sorry to disturb. Yes, I wanted to ask in labor ward, how should we proceed? Because there are two school of thought. One is they are saying that first you say that this is my top urgent case. These all rooms are my semi-urgent. These are the routine. So in the beginning, only 3 sentences for this, and then go room by
Dr. Ruhi will answer this question.
Yeah.
Dr. Ruhi will answer this question very well. What I did, I cannot go. When you perform in exam, you cannot go like this. Nothing is systematic. So you just go room by room and you could start saying that, yes, this is, I feel that this is urgent, I will do this. Next one, okay, this is non-urgent, I will do this. So you will not have time to sum up that these cases. Am I okay, Dr. Rui? Am I right? Like, you don't have time to, to gather the things and just go room by room.
Yeah, that's what I told you, Khushbu. Don't worry. Labor ward is very easy. If you will just, you have to scan all the things. You need to do practice. I was always used to say these people also that you need to do every day 2 or 3 labor board with your partner, and you need to practice yourself that you can scan what is the urgent case topmost. First you have done that one, then you will go one by one, room by room, because you are alone. They know that you cannot run from here one place to another place, and you are alone. So don't say I, as Sabine said. You all always go with your team. They like if you will involve the team. If you will say I, then they will say no, this is not the safe doctor. So Khushbu, don't worry. Only the urgent one you need to talk first, and then you will go room by room. Just relax and do it like that.
Yeah, then we have Bibha with us, and she has got a very, I think, good comment from the examiner about finishing her labor board and gynae board. So let her talk what is her views about the labor board preparation. Bibha, over to you. You just can share your tips and tricks. With
Hello, ma'am. Am I audible?
Yes, you are audible.
Thank you. First, I'd like to thank you all my 4 mentors. This group has been very good for me. And I decided in the last moment, in the last 1 month, that I'm going to do this. Though I was part of this group silently for a very long time, but decided about doing the mocks and the labor ward scenario in the last month itself. And it has been very fruitful. I benefited from it, especially the labor ward scenarios done with you all. Wonderful. I finished my labor ward scenarios completely. And fortunately, my examiner was happy and I passed. Hello, ma'am.
Yes.
Congratulations.
Yes. All 4 of you are wonderful people and you guide us very nicely. I'm really grateful to you all.
Thank you so much, Bibha.
Thank you.
And we are very
Congratulations, Bibha.
Thank you, Dr. Fauzia. Thank you.
Okay. Many prayers for your success in the future for all of you, and continue your effort. Do your OET.
Thank
We
you.
are
Thank
starting
you.
Good luck.
OET free course in
Thank you so much.
few weeks.
Yeah, we are all happy because you people were very good, and you need only little things to improve. And we are happy
No, you were,
that we are
you were
sharing.
Actually,
you all were really helpful, and it was great time with you guys. It's you were really friendly.
Actually, it's the it's a participation which is important, and we have seen the girls who are participating doing the task.
Yeah.
They are responding and they are submitting their audios. They always get positive results. When you guys say that we are busy in job, we are busy in families, we don't have time. Even if you have paid, but you are not attending the sessions, you are not getting benefit.
Yes.
Is once
And
you enter into something.
I want to interrupt. I want to say to girls that don't see your time schedule. It's just 10 minutes. You are driving, you are in kitchen, you are working, you are in like cleaning. 10 minutes you can speak. That's all. Don't bother about the time. It's 10 minutes. You need to speak for 10 minutes, walking, roaming here and there. I was cooking, I was in driving, and I was just speaking for 10 minutes. So it's just matter of 10 minutes and you know everything. For 10 minutes, you don't need to open a guideline. You need to say, you need to speak. You like fake until you make. So do this.
Ma'am.
That's all. It's nothing. It's just matter of practice.
Yes, ma'am. And ma'am, can I say one more thing?
Yes, Vibha. Go ahead.
Yes, Dr. Ma. What happened after the examination, we were sharing our exam experiences, especially with Sabrine and me. Both of us were so different in approach with one case emergency contraception, and both of us passed. So thank you very much to your group that we should go with the patient. We should answer her questions.
Okay, thank you
And
so
patients
much.
are, and
Thank you.
and Biba, you also must have noticed that patients are really good. They are very cooperative. They
Yes.
guide you. If they feel that you are distracted, they take you in the tunnel, and they are
Yes,
really
ma'am.
helpful patients. And this is, I think this was the good sign. I was thinking maybe these patients are annoyed, or I'm going out of track, but no, it was they will guide you. So just
Yes.
give them time. Give them time, let them speak, let them say, and then answer them very calmly. That's all. This, like, yeah, it's not
Yes, ma'am.
difficult.
I learned from your course because
Thank you.
we have to just listen to patient. That is the most important thing. Thank
I
you, ma'am.
believe
Thank
that,
you.
yeah, this is the basic thing which we always said to you. Always ask open-ended questions. Let the patient talk. Let the patient express her concerns, her agenda. You have to dig out information from the patient. So information gathering is the time when patient should talk and you should listen. So you are collecting the pathway, you are collecting
Yes.
information so that you can give according to her concern and you can satisfy her. So don't give your agenda, don't talk too much, let her talk. Ask from her repeatedly. Is there anything you
Yeah.
Yes.
do you understand
Yes.
with me? Am I making sense to you? So these things are very much important.
Yeah.
Yes,
Yes.
ma'am.
So much, Sabine and Bibha, we are too much happy for you. You are the shining stars of our group, and we really love you.
This is because of you, Dr. Ruhi. You all of you. You were
Thank
really
you so
kind to
much.
us, and it was a help,
Thank you,
great
ma'am.
help. And in the end, I want to share one thing more, because this was my second attempt for the online exam, and I had difficulty both times in reading scenario. And the if you are giving online, the task is coming down, and I was not able to open it during the during my performance. And it was really hard time this time also, like teaching station, like post-op, I could not able to
Yes.
read it. And then I was trying where to pick, where to touch, how to see it again. So don't be
Right.
panic. This I second time I also know, maybe you guys are good in computer and you can open it and you can see it, but for me I could not able to see it. So I was really scared that I'm not able to read again, because in 2 minutes went, and then I was searching for the other parts, other investigations. So if you are very good in grabbing all papers, all presentation, then okay. And if you miss something and your station starts and now you cannot see anything, then also okay. You can, I have to use this phrase sometimes, that I could not able to see the investigation. If you will say something, maybe they will say, they will give you, okay. So don't be panic if you could not reach reading completely. That is also a lapse. Don't be panic about that, and just go ahead and talk, and imagine, suppose, make assumptions in your head, and then ask patient or ask examiner that I could not be able to read a last investigation or the other papers, or I cannot able to see on the screen. So this is how you can compensate. So don't be panic about that.
Thank you so much, Sabine, for all your advice, your golden words. So now I would like to ask Kanchana to give her feedback and her guidance to others.
Thank you, ma'am. Ma'am, thanks to Dr. Huma, Dr. Ruhi, Dr. Khalida, and Dr. Fauzia. I could clear this exam in my first attempt itself. So what I would really like to say is, first thing is, as Dr. Sabine said, the firm faith in yourself that you can do it is the first starting point. The second thing is that you need to have a consistency and you have to have commitment in what you're doing. Like I had
Yes.
joined this group in the month of February, and I told, initially when I first gave my presentation, I really did not get a very good comment. But then, like, you listen to others' presentations, you listen to the feedback given by the mentors for the others' presentation. So that is where you also will improve apart from practicing by yourself. So that is also very important. When the mentors can listen to about 5 to 6 presentations which are submitted every day and give they give comments for about 7 to 8 minutes, their feedbacks. So when they can do that in their busy schedule, when we are preparing for our exams, we definitely can listen to all those stations. So for me, that I felt it was very, very important. Next thing was that mine was an online exam, and so regarding the exam, like I did have plenty of time. I thought those 2 minutes will not be enough for me to read the scenarios. But then there was I felt that 2 minutes was more than enough. You can go through the scenarios 2 times, and then you can mind map like what you need to ask the role player. The role players are very friendly. Like as Dr. Sabine said, they guide you to what you need to talk. Be focused in your information gathering. Don't ask unnecessary points. In the patient safety also, just see what is very, very important not to be missed for that particular station. And when it comes to management, you tell what the particular situation means to her, and you just ask her like what are her concerns, what are her thoughts, how she wants the treatment to be, and then you give her the options and she will be giving you the questions. In all the stations, in all the patient structure stimulated tasks, the role player has about 4 to 5 questions. Just answer those questions in detail. Ask her whether you're clear. Ask her whether she has any doubts. Definitely in those 4-5 questions, our management plan will be complete, and you will still have another 30 seconds left in that station. So all what is I learned from the mentors is just be patient oriented, and then just listen to them and answer. And even in the structured discussion, the examiner has a series of like 4 or 5 questions, and just answer to that questions. Make sure that you do not leave any important points, and then that's all is enough from my side. And another thing which I felt is that when you fumble in one station and you did not do that station well, just forget that station there and then itself. When you move to the next station, think that you're performing a new station, forget what you have done in the previous one, and start fresh. This attitude is very, very important. Finally, Part 3 exam is very easy. It's a very much doable exam. This I felt immediately after my exam is over. Even if I could not have cleared this, I would have still thought that this is a doable exam, because it's a very simple exam. It's just tests only our basics. More than the applied clinical knowledge, the communication part is very, very important. Whenever you're speaking with your patients, try to practice in the way that you're as though you're speaking to your role players in the exam. So automatically you will come into the track. So to all the candidates who are going to do this, it's a very doable exam. Just be consistent. Post all your stations in the group, which they are going very systematically. I can see Zobia ma'am is doing a great job now. She's doing all the stations now. So one by one, the mentors will be taking care of all the stations. So be consistent in posting that, and you will definitely do well. So this is my advice. Thanks a lot to all the mentors for being so patient with us, and because of that only we are able to be giving such advice right now. Thank you so much, ma'am.
Yeah.
Thank you, Kanchana. You have been so wonderful, and congratulations. You passed the exam in first go. We are so much proud. Thank you so much.
Thank you so much, ma'am. And one more thing which I would like to add is, please take at least minimum 1 or 2 mocks. Minimum 2 mocks, I would say. I took the mock with all the 4 mentors here. They equally divided all the tasks. None of the stations were repeated with any of the mentors. And I took the labor ward prioritization, and also the gynae board. And everybody was amazing. They told us like what we need to talk, what we should like be careful about. So with that practice, we can keep practicing every day. And I was able to complete both labor ward prioritization and gynae board within 10 minutes. So, and what I felt was the examiners were mainly seeing whether we are missing the urgent ones as non-urgent or routine. So those prioritization and your communication and leadership skills, prioritization skills are most importantly looked into that. So that's it, ma'am. Any questions I will be able to answer in the group, because I have work now, so I have to leave. So anything I will be glad to help anyone with any advice, ma'am. Thank you, ma'am.
Thank you so much.
Thank you so much, Kanchana. We are very happy for you.
Yeah.
You were really very work hard candidate, and we know that you will pass. We knew that.
Thank you so much, ma'am, for the confidence.
We are so happy for you.
Thank you so much. It's all your blessings and your prayers for us, ma'am. Thank you so much.
Thank you once again, Kanchana. Now we have Rabia with us, and she is a very, I would say, very hardworking girl, and she improved herself dramatically, tremendously. And I was much pretty sure about her that she will pass. And there's another girl, we will talk to her afterwards. All of them, they were wonderful. So, but some of them, they worked so hard to pass this exam. So Rabia, I would like to get your views because you are a very much important person for us, for all of us, because
Thank you, ma'am. Thank you so much. Thank you so much, ma'am, for your words. And Dr. Uma, you mean a lot to me because I was like very depressed and you were a big support. And your Telegram group, free Telegram group, improved me a lot first. I was unaware of all the 4 mentors until I joined this group, and the free group in which I posted um, uh, my daily task, and there was very good feedbacks and which opened my eyes.
But I'll
Hello?
definitely give you a chance to
yes,
participate.
somebody is talking. Let
Hello?
me mute her. Who's there?
Okay.
Anam,
Akshit.
mute her. Okay, just you go ahead, please.
So in that group, all the 4 mentors give the task, and it means a lot to me because it opened my eyes. I got to know that which deficiencies I'm having in myself. So that encouraged me to meet you all 4 mentors in person, and I joined the mock circuit. And you, Dr. Khalda, Dr. Ruhi, they all are very, very good and very organized mock. And the thing is that when you give us feedback, it was like so elaborate and it was so good that helped me cope in the exam. Previously, I used to make the mistake that I was not in a habit to listen to the role player. But with this, attempting this mock, I got to know that how you can listen to your role player. So reducing to the role player, and just few info I collected from the role player, and let her speak. So she asked question, I give them answers, and it takes like hardly 6-7 minutes, and in the rest of 3 minutes you can finish whatever the important information regarding the case you think you need to give to the patient, like what how and course of the pregnancy, how about delivery, how about the postpartum care in any module. Like there was a station in which there was a previous preterm, and this time the patient was on surveillance and she was having a cervical length, and it was like 5-6 papers. So I was not able to read completely those papers. So I was not panicked. I went in. I just talking to the patient. I said that I will also look into your notes, because there were 3 things in that station. One is that your consultant is away, patient is waiting for 1 hour, and also the notes are missing. So I was like, before that, I used to think that how I can cope, but after attending your circuit and your feedbacks, I know how I can deal with 3 situations. You cannot say sorry 3 times to a patient. So I said that first I apologize, my consultant is away. Then I said that I can see that you are waiting and it must be very difficult, but I'm sorry, we have a busy clinic today. So third time I said, I personally feel that your notes are missing. I look into into this matter by myself, and let me tell you that I will come back to you why your notes are missing. But meanwhile, I need to ask you some questions to have more information about you. Then I just read through her notes after taking her permission, and I got to know that there was a last paper in which the cervical length was 20 mm. So I just just like info specific points on shortening, and then info sharing, and then I told her everything which I could do the best. And this was a lay examiner station. When this was my last station, when I finished the station, the examiner said me that you are one of the best among 14. Although I was not supposed to tell you, and I immediately remembered Dr. Huma, because Dr. Huma and Dr. Khalda took my mock, and they were so encouraging for me to sail through this situation. Thank you so much for being there, Dr. Huma, Dr. Khalda, Dr. Ruhi, because I was not interacting with Dr. Fatim, so I don't personally know her. So all these 3 mentors are actually very good, very, very, very good.
Rabia, it was your hard work, and it was your, how smartly you did this exam, because I told you this is the exam of smart people. You have to have some dramas, you have to have some creativity, you have to show concern, and you have to interact with the patient. Once you do this, you will pass the exam. So it's as simple as you understand. So don't, obviously you learn how to make the things easier for you, how to take care of the patient and how to follow the patient's words. Even if you are not able to read the scenarios, then you can be very smart and active, that you can ask the patient and you can answer her questions. Even then you are going to pass the exam.
Yeah, exactly. This is the way, like we were discussing that there was bullying, and in that station there was also reflective practice, but it was not written. But like me and Gul were discussing in the room after we give the exam in Malaysia, that like Dr. Huma told us that you have to do the reflective practice and you write in the e-portfolio, and like this is the way you did one of the station with me and Gul. So we were remembering you while we were sitting in Malaysia in our room.
Okay, thank you so much, Ravya, for the great words, and congratulations once again. I am so happy that you are sitting in a district hospital, but you have managed to pass this exam. Very prestigious degree, and
One
I
thing I
hope
want
you
to say
will.
that along with all of you, I would love to say thanks to my study buddy. Thank you, my study buddy, for being there for me. Thank you so
Definitely,
much.
definitely. Your study partner is a pillar, and she is a key to your success, because an honest study partner is just like a treasure. Thank you so much.
Thank you.
Yeah, exactly.
So now we have
Thank
Sadia
you
Happy
so
Palekar
much.
with
with
you,
us.
Rabia. So happy for you, Rabia. Good luck for your next endeavors. And it's very lovely to hear from you and from our all candidates who were struggling, and now they are sharing their success with us.
Thank you,
It's
ma'am.
really
Thank
very
you.
happy.
Thank you so much. Thank you for your support and for your encouragement you give to all of us. Thank you so much.
Thank you so much.
Welcome, my dear.
Okay, now we have Sadia Palekar with us. She is one of the shining stars in the galaxy of MRCOG as well. So, Sadia, if you are around, please, we would like to hear some words from you as well.
Assalamu alaikum, doctor. Good evening, everyone.
Good evening. Walaikum
Hello.
assalam. Yes,
My
I
voice
can
is
hear
clear,
you.
doctor.
Yes. Yeah.
Dr. Huma, Dr. Ruhi, Dr. Fawzia, Dr. Khalida, I should thank all of you, because believe me, friends, I was not a regular one in the group, but I took their mocks, and very 2 or 3 mocks I took with them, and even the labor ward and the gynae ward. That really helped me in my exam, with respect to time management, with respect to how I should approach, what I should talk. And they have always given me positive feedback, encouragement. So that is one thing that I would suggest to all of you, that be very in the group, in the daily group, when they post tasks, because the mentors, they give you a very nice and detailed feedback, and that will help you in your exams. I can see participants in the meeting today, all of you, in fact, you must have attended more tasks than me when I did for my exam. So it was like God's blessing that I cleared. But some 2-3 points which I'd like to share with you all, and especially after the experience in the exam, if it's, I hope it helps you all on this. During the preparations, as I mentioned, that be very consistent in the daily tasks, because to begin with, all of us start at more than 10 minutes when we are performing a task. And I was like that. I used to be more than 10 minutes, only when frequently we perform, and then we give the mocks at the end. Because just doing one task a day, you will not understand exactly, like the flow of it and how to go in exam. When you give the mocks as well, so the time, the punctuality in performing the task would come from only the practice and not just reading the guidelines. One thing that I had done was, like, I had attended the RCOG revision course prior to my exam. Dr. Huma, you were one of the, I think, examiners that time, or one of the case presenter, the one who were taking our cases that time. So in that also, they had, this was of importance, that they told us that we are not here to test your knowledge. Your knowledge has already been tested in the part 2. This is just the time management. And here in part 3, we are not going to treat the disease. We are going to address the patient and her concerns. The disease is just a part of it. And believe me, friends, in the exam, it is not that this patient has just one particular disease. It is not like that. If I can give an example, like one of my tasks was a patient was asking for HRT. And she went on and went on. Like, first thing was that she had endometrial cancer, which was treated. Then she had a benign breast disease, which was treated. She's benign hypertension, family history of stroke. Like, it is not that I'm giving HRT just like that. I'm giving HRT to this person who has all these 4 points in thing. So it is not just a disease, it is a patient which is going to be treated in this part 3. So even if you don't have like too much knowledge about the disease, it doesn't really matter much in this exam. So this is one thing that I really experienced in the exam. Dr. Huma, please correct me if I'm giving any wrong tip or anything.
Sadia, you are good. You are good in RCOG course as well. So you are good in mocks, and that's why I was telling you that you're one of the shining stars in the galaxy, because you're good and your communication was very good. All of the girls who passed the exam, even the girls who are doing them, most of them, they are very good in communication, but we just have to, skip the things which are not important and just make ourselves more focused. This is what RCOG wants.
Exactly, doctor. This is, as I said, it is not about the disease, it is about the patient. You have to concentrate on the patient. And as Dr. Kanchana mentioned, listen to the role players. They will help you pass the exam. My preterm station, which it was, the role player asked me questions, 4 or 5 questions. I think that just covered the whole task. And the examiner looked very happy about it. So just listen to them. And in between, I'm sure the mentors also tell us, and this I've learned from the mentors, from Dr. Khalida, Dr. Huma, I have learned from you all. In between, ask the role player, am I clear? Do you have any questions? At least a couple of times or 3 times. When you say, do you have any question? Immediately she will come up with a question which will help you score. This is because sometimes, we can be off track. We can just keep on talking about one thing while she wants to listen to something else. So just stop and just ask her, do you have any questions up until now? She will tell you that, and she will again put you back on track for that particular day, for that particular task. This is very important. And as Dr. Huma mentioned about the communication, the patients, they love you the role players, they love you if you are slow, soft, nice, because I could see their expressions when you do that. When in one station, like to begin with the first station, I was very confused, and I could see that the examiner or the role player was not very happy to begin with. And then I composed myself. And then in the later stations, I could really feel that. So they give you a hand. They want you to be talking to you as if you are very friendly on a day-to-day consultation. It is that this is what the role players want in the exam. With respect to preparation, in part 2, whatever guidelines we have studied, apart from that, just go through the recent ones. Because like my preterm station, I don't know, it was like from God that the preterm station, couple of days ago, when I just went through the guidelines, I saw that NICE came up with this 2022 guideline on the revised guideline on preterm. And there were 4 or 5 points. As I mentioned, my role player asked me the questions. She asked me exactly the same questions which are there, those 4 blocks in the headlines in that preterm guideline. Just the 4, Dr. Huma, believe me, the 4 points which were there, she asked me that. Will you do a cesarean for me? Will you do a intrapartum CTG for me? Will I deliver today? What is the neonatal prognosis? It is just like that pickup of those block points from the guidelines. So if there is any particular guideline, just see if there is any revised one and just pick up just the block points that is important. That was one experience I had in my exam.
Yes, you're very right, Sadia. That was the reason that we were asking all the candidates that we have started this long course and for you to do the guidelines, because there are a lot of changes and they are taking the information and they're taking the questions from the guidelines. So once you think that you're going to skip and you're going to focus on the recalls only, then it's not going to help. it's much more expensive than previously. So you have to be,
Yeah. Even
work hard.
yes. Even Dr. Roma, if you're talking about the recalls also, like as I mentioned, it is about the recent points in that particular station. Even if there is a recall, there is a recent point maybe in that, like the preterm. It has this, the 2022 had it. And I was really shocked because I was not expecting that. And it was from God that I just had looked through at the last minute. And when I came to know that I'm in the exam and I got it, I was really not expecting. The role player asked me exactly the same questions which were there in the guideline. So even if you just go through the block points, even if you're doing the recalls, just go through the block points if there is any this thing in it, change in the guideline which is there coming up. And then the labor ward and the gynae ward. Friends, please take the mocks and the labor ward and the gynae ward with Dr. Huma, Dr. Ruhi, Dr. Khalida, Dr. Fawzia. I really, really improved myself. Really, I'm not just telling it for this meeting, Dr. Huma, today. I really improved myself after the extensive feedback that I got in the labor ward and the gynae ward, which I did with you, Doctor. The labor ward is it's in the exam. For me, it just went on. It's not necessary that you're going to be having just 3 cases, 3 evolving cases, not like that. For me, in the labor ward, out of the 8, I think 5 or 6 were evolving stations. He was just coming up. So just don't go by the thing that there can be only 3, like 3 or 4 only evolving. When you have the labor ward in it, begin with whatever you feel it as urgent. But keep your mind open that anything can be evolving, anything can become urgent. You just have to spontaneously come up to what the examiner is going to ask you. Just don't keep yourself mentally blocked that this is it. And this is what I learned also from Dr. Human and the mentors here when I did the labor ward and the gynae ward as well, Dr. Ruhi and Dr. Fawzia. Because if you get stuck that, okay, fine, this is like 2 slide, 3 evolving. If I have this, that okay, next will be semi-urgent, next will be routine, and you will suddenly get fumbled if the examiner gives you an evolving situation suddenly in the middle of the talk. So just practice yourself that anything 8 out of 8 can be evolving. Dr. Huma, just correct me if I'm wrong, but this is what my experience was in the exam, doctor. Apart from what Dr. Kanchana mentioned, I think she elaborated everything upon the kind of practice, but this was like my experience, what I had in my exams and all the mentors. I remember one station I had posted in the task and Dr. Ruhi had given me the feedback, and it was such a wonderful, long feedback that really helps, friends, that really helps. Thank you so much, all the mentors.
Excellent. Yeah, you were excellent student, and we were suspecting that you will clear the exam. And it's just little things that you need to improve. Very good.
And then even when Dr. Kanchana said that when you get stuck to a station, friends, the examiners are sometimes they can be very tricky. I had a case. This was my 8th task. And I'm not here to scare you all. It is just that I'm sharing my experience so that we are all alert in the time of exam. So I had this case whereby this was day 2 urine output, which was not there for a patient suspected urinary injury or whatever. Like this examiner, he asked me one question: what is the immediate management? Although I told him everything, but still he was not happy with my answer, and he did not progress further. That was my bad station because I knew that I don't know what he wanted. I didn't do. And I remember in one of the mocks, maybe I got stuck and I could not go. Like, you tend to have this mental block. But because we practiced in the mocks in the exam, when I had this bad station, I just left it. My 9th station, immediately the next station which was there, it was maternal collapse. And suddenly the examiner is giving me a compliment. You are really very nice. It's commendable. After a bad station to come out, this is very important, friends. Just practice that. If you have a bad station, leave it there and there. Just progress ahead because it's very important that way.
Yeah, control your nerves and move on. You never know
very much happy that most of our girls, they got good sort of compliments for the exam. So these compliments are not for you; these are for us as well. So we are very much happy and proud. Whatever you guys have done, you just made us proud. Thank you so much. I believe if I have left anybody, Dr. Amreen, Dr. Khalda, can you guide us if somebody's left who wants to give feedback? And if there is any question, please do ask from these girls. They are now, MRCOG experts and they can guide you much better.
Yeah, I think everybody has done. So the forum is open for all of you. Whatever the queries you have, you can ask from us.
The girls who are not able to pass this exam this time, please don't lose hope. So because, everything have their own time. Your time will come definitely, inshallah, and you will go, all of you will go through that. So just if there is anything you think that it is different and you have done this thing much better in the exam and you want to know the perspective of the person who have passed it, kindly do communicate with your friends now and ask from them.
Hello. Hello, Dr. Huma. I have some queries in my mind. Can I ask now?
Yes, dear. You can ask. You can ask from any of the girls who have passed the exam. You can ask from the mentor, but whomsoever you want to ask.
So there are some queries like in this exam, as I appeared before as well, but in this exam, as they all mentioned that they were though recalls, but there were a lot of twists in each of the stations.
Yes.
Now this time, like starting from the information gathering, and then when the time comes when you are information giving to the patient, and we were seeing that some of the patients were quite good and they were quite progressing with you. So you mean we thought that this is going well, but in terms of some patients were quite, a quite stubborn type, or they are not going that way. So either where could be the problem? Either there was too much information given to the patient that could lead to failure, or what could be the reason?
Nasiha,
because
let me tell you this thing. I have told this to my girls a lot of times. When you see a role player who is tough and she is not responding and she is, showing faces because they have been given instructions by the Royal College. Just keep this thing in your mind. If you are missing, you are not on the right track. You are going on the wrong direction. They will make faces. They will show you the attitude. And because when you are on the right track, they will share each and everything with you. It has happened in my exam as well. I had exam. I told the girls that I had Alport syndrome in my exam, and all my colleagues who were there, I think I was the only person in the exam to whom the role player shared some different information. Just the recalls, all the recalls which will be in the exam, they will have twist. They will be given different information. They will not be exactly same in the previous you have seen. There'll be different information the role player, and they will only give you the role information if you are going to dig them out. This is what the Kanchana and Sadia said, that when you are going to ask them again and again, am I making sense to you? Is there is confusing? Is there anything which you want me to explain you? Is there any question? Only then they will open up. When I appeared in the exam, my friends, they were telling me that my role player, she was not talking. She was just sitting and she was not giving the information. Did you ask your role player again and again? Is there any here? Because, the Alport syndrome patient had amenorrhea and nobody, and her UPT was positive. I was just asking her that, have you used a sort of contraceptive? Is there anything? When I asked her again, then she opened up. She said to me, I have Mirena inside me. And she didn't tell Mirena to anyone else. When you have Mirena and you have become pregnant, then this is the thing they want to see, how you are going to react. You have to localize the pregnancy with the Mirena. Is it ectopic or is it intrauterine? You have to offer all of the Mirena because it will cause a miscarriage. And believe me, with all other girls, my partners who are studying with me, she didn't share this information. And I asked them, did you ask your role player questions and again? Did you clear them? Because, they are very helping. They will help you. They always want you to pass and they will show you the pathway. If they are angry, they are not coming down. If they are not showing interest, this means that you are missing something. which you to
Yeah, like, for
realize.
example, Dr. Huma, one of the patient like the bladder pain, which I was telling you, the bladder pain patient was like, it was the scenario outside. It was written as the next patient is the patient who was referred by the GP, and it was bladder pain, and that the task was three. It was a short, but this one sentence, and the task was take the detailed history, answer the patient concerns, and help in planning the management. So when I entered and I like open up the station and ask all the bladder type questions, and the bowel questions, and the chronic pelvic pain typical questions, and the sexual abuse signposting before that, and then muscular problem, and at the end when I started information giving to her. So when I started with the management, for example, with the conservative like the spicy food and the coffee and the beverages, and to that will change the painkillers because she was on the painkillers already. So she told me, and it was almost 1 minute like that, will you just give me the painkillers and I will go? So I think that time I thought that maybe I was so rushing that she doesn't pick my words. But I told her that I will give you some this amitriptyline, which are the specific for this bladder pain, and these are the side effects. But I think I was so rushing that she hasn't picked at all. And then when I asked one question in between that, is it affecting your sexual life? So she very rudely told me that definitely this is affecting me, and that's what I'm telling you. And then when I signpost and go in the sexual history, that how it is affecting, either it is in the superficial, in the superficial entry or deep intercourse. So then she replied that no, not like that, but it's affecting me. No, I'm still confused at what was the meaning of that sentence, because she was telling me that I have vaginal pain, and the only pain that relieves is when I pass the urine and I get relief. This is the only factor which I have noted. So it was typically a bladder pain scenario, but I don't know that patient was not going with me. Though I at the end I involved urologist, and I told her that I will involve a consultant with urologist, with write to them. Maybe they will examine the bladder with the camera, and maybe they will instill some fluid if this medicine doesn't work, or like that. But I don't know. She was aggressive on this one question that I'm telling you that it is affecting my sexual life. And then secondly, at the end, she told me that, will you give me some medicine and I will go. And then so I was, this station was very hard for me. Like as you said, that the exam, that the role play will not let you go. So I mean, there was something missing. Either I was not empathetic, I was not showing that much empathy, I was not asking her the questions. I'm now thinking that this could be the reason.
Yes, this is one of the, these urogyne cases and maternal medicine, you have to share a lot of information and a lot of questioning. So you RCOG, in the previous, not this one, in the previous exam, a lot of candidates, they failed information gathering because they have their pre-prepared sort of template, and they were following their template, and they were not listening to the role play, and they were not watching the role play, the face expressions of the role player. So they were just this. That was the reason the RCOG failed them, because they were not interactive and they were not communicative toward the patient. They were following their own agendas. They were just in a very rushy manner. They can cover the 10 minutes. This is the thing which they don't want. They want you to treat the patient. They don't want you to teach the patient. But teaching the patient, you are not. So these are the things. There must be something wrong. So don't take the failure as it's a very bad thing. Lot of mentors, those were the very brilliant one. They have passed in this third attempts, fourth attempts. I know a lot of them. I have passed in my second attempt as well. But this doesn't make any difference whether you have very good information or you knowledge or not. It's your communication, how you are, give the shape of your knowledge into proper communication, that really works. So don't get disappointed and disheartened by the failures. I know it's very difficult time, and it's not easy thing to say, because it takes a lot of money. You have to neglect your family, you have to give time, and there is a sort of depression and stigma as in yourself. You lose confidence. But please, I just want you to just keep act like warriors. Don't lose, don't fail your wars. You have to win over. And when you have the high spirits, only then you can win over. And please, it's my advice to all the girls in the circuit, in the group. Whenever we are going to give you some information, we do criticize. It's my habit. You might say it's a very bad habit of mine. because I'm doing the courses with the RCOG and I know what they're looking for. So I will not always give you the golden spoons and the, praising words. I will always criticize you, and I will ask you to change your attitude, change your way of communication. The only thing is this, that I want you to get the best out of you. So please don't take those things in your heart and don't get hurt and don't get disappointed, because we meant you to go through in a brilliant way. You get this success. Your success is our success. So don't take it for like a sort of criticism or a bad sign that this mentor is not good. She's criticizing us, because rest of the groups, they're always saying that you are good. If we will not correct you, you will make the same mistakes in the exam and you will suffer. So let us help you, please.
As far as Dr. Nasiha, your concern for this question is that urogyne bladder pain syndrome, the most important question in this station is it affecting your quality of life? This is what the role player and the examiner want to listen from you. And then in quality of life comes this is one of the important question in urogyne module. If you don't ask, they mind it. They like a very long history from for the urogyne module, like 5 minutes information gathering. If you take from urogyne patient, they like it. They like the long history and they like the information gathering of the urogyne. So, and one of the important question in urogyne is that you have to ask from the role player, is it affecting your quality of life or not? And she will definitely tell you. In bladder pain syndrome, one of the important question is, do you have any stress in your life? And because the stress is also aggravating their pain. And it was my exam station, and when I asked the role player the question, she told me, yes, I am stressed. So this question, and second, be empathetic, because looking at the long history and looking at the long information gathering and then giving information to the patient, we think that we have to rush, but the role player doesn't like rushing together. Maybe you will not be able to complete all the long that algorithm of BPS to the patient. That may not be required from you, but they want you to have a good information gathering, be empathetic in approach to the patient, and be assess what the patient problem is and address that. This is not, they don't want you to, as Dr. Huma very rightly said, they don't want you to teach the patient, they want you to treat the patient. So assess what your patient problem is. If she is suffering from pain, what is the cause of this pain? Maybe if you told her that I will ask you from spicy food, caffeine, you have asked, I'm sure you would have asked her from what about your drinking habit? She would have told you. So once, take your station accordingly. Like if a patient has told you that I'm taking a lot of coffee, so then when you come to the management option and lifestyle modification is the first step, you will tell her in this way that, see, Miss Rebecca, as you told me that you're taking a lot of coffee, so it may not be, it has been seen that this is the reason for the pain. So I would suggest you to have a cut down on coffee. In this way, what information you collected from the role player, you put it in your suggestion, in your management to the patient. So relate the things what the role player is telling you. As you told me, as I can understand, as you told me, whatever the evidence has suggested, this would be the best option for me. As you have tried simple painkiller, maybe we will move to the next step now, and the next step medication is this. In this way, explain, take your role player along with you. That is the important part of your communication. If you take your role player, you listen to the role player, you take the words from the mouth of the role player and you apply those words in your communication with the patient, that shows that you are very interactive, that shows that you are listening to the role player very carefully, and that shows that how keen you are in solving her issue, in solving her problem, in treating her. So this approach should be the practical. This is the practical approach, rather than having our template and then
yeah.
this
Yeah, I'm feeling this now. Yeah, I'm feeling this now. that she was really wanting me to absorb all the things and to really communicate like in a real situation, and that I was
Yes.
rushing, and maybe this is the, and I was rushing in most of stations.
Yes, yes. Now you are on the
Rushing
right
is
track.
not really bad.
Just all of you do your reflective practice. So what are the things which you think went wrong and how you correct them? I think Sadia Patel, she wants to say something. Sadia, is you have raised your hand? Yeah.
Yeah, Dr. Huma, as you mentioned about this rushing, this is a very important point, doctor, because when the role player says, I don't want this, ask the role player why she doesn't want it. This is very important.
Yes.
That will give you an answer to the task. Like for me, there was one prolapse station, and the examiner said, I don't want pessary. I want to directly go ahead with a surgery.
Yes.
And she had multiple comorbidities. She's asthmatic, she's morbidly obese, everything is there. Anesthesia wise, she's not fit for the surgery. So when I asked her why, she just mentioned that one of my friends uses the pessary and it hampers her sexual activity. So, you have an option that yes, for such patient there is the gel horn pessary. We can offer you that. I understand that you are keen for surgery, but the surgery has so and so risk factors. We can discuss about having this also, which will not hamper your sexual activity. So
Yes.
the role player will tell you that something which is not irrelevant. She will definitely tell you something which is relevant. So ask
Only
her
if you
why
will
she
ask.
doesn't want.
Only if you will
Yeah,
ask.
only if you'll ask. Because you have to ask her. If you just tell her, I told her that we can offer you pessary. She said, no, I don't want pessary. Please tell me the surgery. That's it. She did not tell me why she doesn't want the pessary. Basically the thing was that, do I have an alternative? So I asked her why you don't want the pessary. She came up with the answer. So when they tell you, please ask this question to them.
Yes,
This
is the thing which I told you. So give the options, and if somebody selects one option, ask her, give the little bit brief of the other options and discuss in detail what she has selected. But if there is something which is she's straightforwardly refusing, do ask her concerns. Why is she refusing that thing specifically? There might be some misunderstanding, there might be some misconcept, so you have to clear those as well. So this is the thing which is important.
And even study buddy, Dr. Huma, I would really want everybody to have the study partner. That helps. Initially, I did not have it, and later on, me and Kanchana, we studied together. You kind of guide each other.
And sorry
you
to
assess
disturb
each
you.
other.
Hello, sorry to disturb you. I just one more question. If you are not able to complete the whole till end management, I mean the conservative, the medical, the surgical, what will happen after that? So is that okay? I mean, will we feel
Yes, Naseha,
patient
the
safety?
answer is this: for each and every station, when you are discussing the option, I always talk this thing to the girls in the mock, in the course as well. All the options, just name them. At least the examiner will know that you have the enough knowledge. Just tell, we have different options. We have the basic, starting from your lifestyle modifications, then we have the exercises, then we have the medicines, then we have the hormonal, non-hormonal treatment, then we have the surgical treatment. Then tell a little bit about that. If you are not able to finish your task in proper time, but you have mentioned the name, the examiner will know that you have the adequate applied clinical knowledge. You know each and everything. They know that the time is limited. Sometimes, like these, especially urogynec cases, there are a lot of options, lot of explanation, even with the maternal medicine. So you should know how to play smartly, how to give the, there's a very long information. You have to just squeeze the information into a small sentences and in a very small space so that you can display it all. So if you have initially said all the things in a one go, and then you start explaining one by one, if you are not even able to finish it, then you will get a pass, because you have told examiner what you know, and he knows that you have told initially all the things and you are not able to explain them in detail, but you know. So though he will pass you.
Dr. Huma, the role players only will take us. If you just ask them one question, suppose you're telling them the conservative management, and you ask, do you have any questions? She will directly take you to the option which will score you the best, even if you're short of time.
Yes.
So that is why that question is important. Do you have any questions?
Yes, the interactive. queries, discussion, open-ended questions. So these are the things which are very much important. Any
Dr.
other?
Uma, can I add something? Can I add something into this?
Yes, definitely. Rabia.
Dr. Uma, there was a situation in which she was having PID and she was on antibiotics for 48 hours. And now she is here. You have to tell her what you're going to do. So the information is for history and applied management plan and answer concerns. So when I asked her, she told me that everything, how she's coping and how she's doing. Then I asked her anything you like to add, and at the end she told me that she's having ITP, and I suddenly remembered that she had the platelets were given 90,000, and she had a high BMI. So in this talk there were lots of things. The other tube which was shown that was also having hydrosulfate, and one other tube having tubo variant.
Okay. I think something is wrong with the Rabia's network is not proper. Rabia, your voice is breaking.
We are dealing with that.
Rabia, your voice is breaking.
We
There's
are
something wrong
like
with your mic.
having or
Anybody else wants to ask any question? Otherwise, we will move towards Dr. Zubia. She's going to discuss one case with you. If somebody has any question, please come up.
Ma'am, may I ask one?
Yes, definitely, dear.
Actually, regarding that rectocele and cystocele question, I had entirely different experience from Sadia, because my patient told me that she will accept pastry, but it fell down and she was not happy with it. So if I can provide her with a good pastry, she can accept it. And then her next question was, may I change it at home? I said no, because she had some injury at ST5 level. So I said no, because you may get attack or something, you'll have to come to hospital and we will change it. And then she opened up during intercourse. She had that attack once. So they change stations, I think.
Yes, they do. This is what I just want to tell you, that there is twist in recalls. Don't memorize them from word to word and sentence to sentence, because even if they are going to give you one scenario, there are different sort of situation, different scenario. They have given the information to the role player, and sometimes the role player, they do change the information. The same role player will give different information to different candidates. So
yes,
don't memorize the recalls. Please just understand what are the things, follow the template, but you have to follow the patient.
Thank you.
Even on the same day, Dr. Homa, I think the station, although the task is the same, but even on the same day, the information is different to different candidates, I thought, when I compared one task with my friend.
Yes, I agree.
Yes, it's always like this. It's always like this. Every candidate will get, there are 3 to 4 scenarios they are preparing with one role player. So with one candidate, he will give one information, with other, he will give another information. But it will be playing around your station, like if you know about the pessary, if you know about the vaginal prolapse, if you know about the surgery. So it will be all about that. Nothing different. But this is what we want. Those who are now going for the exam, our sincere advice is for all the candidate who is going for the exam. Okay, just take the recall, but don't stick exactly to that template and that final management. No, just take a recall of uterovaginal prolapse and think about what the patient can have these management options. Okay, if she doesn't like pessary, where I will go? If pessary fell down, maybe she is very old age, she may need colpocolysis. So move around different management options, think about different scenarios in your mind, create it, discuss with your study partner. And once you believe me, if you do your preparation in this way, nobody's going to fail, because you will be ready for each and everything. And the recalls are just to help you and to guide you how to start your preparation and where to go. Recalls are not for this thing that you should memorize them and just practice them with your role player and then close your book and sit down. No, This is not the way to prepare the part 3. To prepare the part 3 is to have a discussion with your study buddy. Take out the guideline, take out the leaflets, take out your template. These are the 3 things which are required for your preparation for any, like urogyne module. You have very few guidelines. Hello.
Yes, Dr. Khalda is right. Along with the Dr. Khalda is telling, the study partner is very, very necessary, and you have to recheck. You should be very honest with your study partner, because a study partner is the one who will tell you about your mistakes. Because when you are talking and when you are so you maybe you miss many things, but he or she is the one who will tell you that what you have done wrong. So your study partners are very, very, very necessary for you, and they are your lifeline. And make 2 or 3 study partner, because all of you are working so all the time, all are not free, and you can get if you make 2 to 3 study partner, they will help you with the different ideas, and they will improve you with the different ideas, and you will improve the lot of people to pass the exam. So like this, when you have got the stubborn patient, just negotiate with her, just read her what she wants. If you the patient for me, she has cytosol and rectosol and a little bit grade 1. This one, UV prolapse in my exam, and she was a very stubborn lady with a lot of medical problems. She's non-asthmatic, she has cardiac problem, she is hypertensive, she has one-time DVT, she is diabetic also. So the problem is that she's not fit for the surgery, but she is like adamant. So I started with the surgery, but I told her that for surgery, in the end, I told her about surgery. She was very happy then. Then I told her that for surgery, she needs anesthesia consent, fitness. And for this fitness, we have to refer her to the diabetologist, cardiologist, pulmonologist. And when they will give her consent that she can go through the surgery, then anesthesia will give her anesthesia. So she was very happy. And at that time, because in the beginning, she told me, don't tell me about the ring pessary. But in the end, she agreed for the ring pessary for the time being till her medical conditions are settled, and all the physicians will give her fitness. So this is the thing. You have to catch the nose either from the right side or from the left side. Okay, so if you negotiate and you see the patient is very stubborn, start from where she wants to be started, but let her agree according to her situation on the things which she was not agree. She smiles in the end, and she said, okay, doctor, give me pessary and I will go to my physician. And this is the last thing, because it was written that she's not fit for surgery. So make her happy. Start with what maybe you don't like that one, but it is necessary for her. Okay, start with her idea and take her to your idea. I think it will be helpful for all of you. Good luck for all those who are giving exam in November, and heartiest congratulations and lots of love and prayers for the success in future for those who pass the exam. This is all from the Dr. Fawzia.
If you don't have any other question, then we can ask Dr. Zobia to come over and discuss one scenario with you. If there's
Ma'am, yeah, can I ask one thing, please?
Yes, definitely, please.
Yeah, ma'am, thank you so much for providing this platform. Ma'am, just want to know one thing, that if in exam like the applied knowledge and the safety is not up to the mark, right? So ma'am, it means that we are not giving that information that role player and the examiner wants to listen from us. And ma'am, so even for example, if in any scenario we are giving in the management plan, we have told her about the MDT and the lifestyle, and then the medical, and then the stepwise surgical management, we have given her the options. And at the end, in between, we also ask about her concerns and the questions. But ma'am, even if it is not passed, then ma'am, how to figure out that where we are lagging and what things that we are missing? Maybe we are giving the wrong information, that they are not don't want to listen from us. So ma'am,
Dr. Ruhi would like Would you like to answer, Zahra, please?
Hi.
Hi, ma'am. Thank you.
Zahra, hello, Zahra. As I mentioned, you asked the same question in the group also, and I told you that you cannot say that you have the four or five domain that you need to complete in the exam, and if you will keep on practice with your partner, and you know exactly which domain you are completing and how you are completing, because the patient safety, I told you all, and every time I'm telling you that it is not the part of that you will just ask the allergy and your patient safety is completed. By asking the name of the patient, it is the patient safety. By relaxing the patient when she is one question, one case in which there is a mental health, there is a patient, she is asking, keep on asking for the candidate that where is my baby, what will happen to my baby. So if you are keep relaxing and giving the few some good empathy to the patient, this is also the patient safety. So this is not like that you can say that I speak up this point and this point, then why I failed on that point. You never know. The main thing in the exam is that they are not giving us all the 14 station feedback one by one. So you never know that on which station, maybe you are thinking that this station I did very well, maybe you failed on that station. So you never know that which station you have done bad. The main thing is that you practice with your partner, and keep on asking, very honest partner. This is very important. Some of the partner, they are just telling that you are doing very good, very good, very good, very good, and then you are happy, because sometimes they realize that if I will criticize you, don't like to that criticism, so they stop criticized you, but they are getting benefit from you, but they are not giving you any benefit in that return, because you don't like to criticize, because you are thinking that if she is pointing out your any mistakes, you are thinking that they are now I did everything good, and why she is criticized me. So if your partner is criticizing you, take it as a positive feedback and keep improving yourself. And and in the group you will listen to the other people. Maybe you are thinking that you are completing the all domain, but maybe you are missing something. I did not listen to Zahra a lot, so I cannot say that. And I ask you that you can talk with me personally. We can discuss the case, and we can tell you that where you have lagging behind, and you can improve that. Sometimes we are thinking that we are completing and fulfill all the requirement what we want, but maybe you are more focusing on your information gathering, and you are not focusing on your applied clinical knowledge. And sometimes you are more focusing on the applied clinical knowledge, but you are not giving that much time for your information gathering. This MRCG exam is not only focusing on the applied clinical knowledge. You need to your approach should be holistical approach. Sometimes the patient doesn't want what you are talking with her. If you will not take pause and you will not ask the patient that am I clear so far, do you have any question, maybe she may need to guide you, and she will tell that what about my future, what will be the prognosis of this disease. Maybe you are forgetting that prognosis, you are not telling them the prognosis, and you are not telling that what will happen afterward. And if you are not telling that thing, then maybe you are losing that point. So it's not like that. Don't be frustrated, Zahra. Keep attending the cases in the group. I'm not saying that you will attend, not necessarily that you will attend only our Telegram group. You can attend anywhere else also, in our group also, but try to listen each and every feedback. Try to listen how the people they are attempting the question, so that you can learn. This is how you can learn from each other. Don't think that oh yeah, I have prepared this case and I know everything about it, and that's it. You know you will have the full knowledge about that topic, but they don't want from you that topic. They want lot of things from you on that case: your empathy, how your approach to the patient, and the same thing, as Dr. Huma mentioned, that there is no need to mention all the guideline to the patient. You can just, for the sake of examiner, that yes, you know the all information, you can just tell, as I told you in the group also, that let us say in ectopic pregnancy, you know that this patient will be treated by the medical option, but you need to show it in front of your examiner. You need to tell that you have, usually we are treating the patient with the expectant management, with the medical and the surgical management. Would you mind me to tell you all? If they have the number for the all, and the role player will say, yes, I want to listen all options. If
Okay.
they have only, if they want to listen from you only the surgical management or medical management, what was appropriate for the patient on the specific case, she will tell, no, I need to only know about the medical management. And it means that they have only the number for the medical management. If you will talk about the expectant management, surgical management, you will speak just for nothing. They will not give you the marks, and you are also wasting your time, and you cannot complete your task. And then you will say in the end, I speak everything with the examiner in front of the examiner and the role player. Oh, they failed me. Why? Because they want to listen from your medical management. It means that the rest 4 minutes is only they want to listen, to speak and speak and speak on the medical management as much as you can. So listen to the role player and be focused, whatever you are speaking. So this is not like that as I mentioned you before, you know everything, but you need to know that what you need to speak in front of the patient. That's it.
Okay, thank you, Dr. Amreen. It's a very, the straightforward answer to this is that I have taken the RCOG courses. I'm still working as a faculty member with them. And the templates which are given to us, they have written some specific points, and they only want to listen to those points from the candidate. And it's specifically written, if a candidate is going to say these things, then she is going to pass the scenario. Otherwise, if she is going to miss 1 point, that is a borderline. If she's going to miss 2 points, then it's a fail. The only example one I'm going to give you, one, if there are certain things in which they want to hear from you, the buzzwords, if you are not going to say the buzzwords, you are be failed in that exam. Like if there's a clinical governance situation, you have to say 5 Ds: the duty of conduct, documentation, debriefing, and what else is there? DATEX, incident
reporting.
Yeah.
Incident reporting.
So these are even if you are not going to complete in details, but you said the buzzword, you will pass. In the urogyne cases, if there is any case of when there is any prolapse in urinary retention and any mass abdomen, if you are not going to offer the examination, you will fail that. So just there are specific things they are looking for. They have mentioned these in the templates, and they have given that to the examiner. So these are the things which we expect the candidate to say. And these are very common things which are given in the guidelines. These are the common things which are discussed in the strategy. These are the things which are discussed in the patient information leaflet. There's nothing new in that. You have to just organize them and you have to use them. If you are going to miss anything even if you have given all the information in the word, but if you have missed a specific one, they will fail you. This is the only answer to your question. Now, is there anything, Dr. Fatim, you want to add on? Please comment. Otherwise, I think we will ask Dr. Zobia to continue with the question, because it's getting too late now.
Yeah, it's better, Dr. Zubia, you will continue now.
Okay, Dr. Fawzia, you want to say anything further? Dr. Fatim? She's here.
I think she has. I think she has done from her side. It's better that Zubia
Okay,
will
then
start now.
Dr. Zubia, I'm making Dr. Zubia the host, and she wants to practice one station with any one of you. Anyone who wants to volunteer herself can come up and do that with the station. Dr. Zubia, over to you. Just let you the host.
Okay, thank you so much, Dr. Huma. Thank you.
Dr. Zubia is a very good mentor, and she has got very good knowledge, and I hope she is going to give a lot into your information as well. Thank you.
Thank you so much, Dr. Huma. Okay, hello everyone. I'm Dr. Zubia, one of the mentor of MRCOG OSCE Prep. Hope you are doing good. Congratulations to all the candidates who passed the exam, and very lovely to hear from you all. And for those who could not make up this time, I would say that don't be upset, don't lose hope. It's never too late to start, and give you some time, some break, and then you can start again. Okay, so keep practicing. This is the only key to success. So for the next station that I'm going to start is, I need one volunteer. Anyone can come up.
Zubia, I think Nasiha, she wants to do. Nasiha Begum.
Okay, okay,
Yes,
okay.
I want to do that.
Okay, Dr. Nasiha, please. Shall I start your 2 minutes? 1 minute. I'm sharing my screen first. Can you see my screen, Dr. Nasiha?
Yes, yes, I can see that.
Okay,
Now
I'm
it's
starting.
gone. Yeah, yeah. It's not. It's only a station.
Yes,
written.
yes.
There are no details. Now.
Yes, yes. It's only station written. Now I will turn the slide and I'll start your 2 minutes. Okay, are you ready?
Okay. Yes, I'm ready.
Okay, start.
Okay.
Are you ready for that, Stacey?
Yes. Yes.
Yes, start. Start.
Okay. Hello, I'm Dr. Nasiha, one of the doctor in the ward today. Can I check your name and age, please?
Yes, doctor. I'm Amanda Jones and I'm 35 years.
Okay. I can see that you are having some problem in your breathing, and that the nurse has called me to see you. So please tell me more about you. Are you comfortable right now to talk?
Yes, I'm short of breath since of 1 hour, and now okay, I'm comfortable to talk, but.
Mm-hmm. Okay, and I'm going to connect some oxygen with you so that you can breathe comfortably. Is that okay with you?
Okay, yes, doctor. Yes, it's fine.
Yeah. And do you have any other like a pain or any sickness right now?
No, doctor.
Okay, and tell me more about your recovery. How was the recovery in these 2 days?
Yes, the recovery was fine. My procedure that I had a surgery was very straightforward, and I was being told that I will be discharged on the same day. But I don't know suddenly what happened since 1 hour. I'm feeling that I'm having hair hunger, and I'm unable to breathe as well.
Okay, and do you feel some chest pain along with that?
Yes, a little bit chest pain as well.
And any blood in the cough?
No, no, doctor.
Okay, and do you feel any dizziness, any weakness?
No, no, doctor.
Okay, and is there any bleeding from down below?
No, doctor, no, no bleeding.
And do you feel some swelling or in your tummy? Any pain
No.
in your tummy?
No,
Okay.
no, nothing like that.
And have you been able to up and about and move around in these 2 days?
No, I was not able to move around. Maybe I was having pain, that's why, or I don't know why I was, more on the bed.
Okay. So have you been able to eat or drink something?
Yes, I was eating.
Okay. And have you been able to pass the urine?
Yes, I can.
And open the bowels?
Yes, doctor.
Okay. And as far as the surgery, can I know the reason of the surgery, of the operation?
Yes. Yes, yes, this operation was done because the doctor has told me that I had some cyst on my right side of my ovary. So that was I had to go for this keyhole surgery.
Okay. And was you having any other medical problem for which you are taking treatment from your GP?
No, no, nothing like that.
And do you have any personal or family history of clots in the legs or lungs before?
Yes, my sister had some problem clots, but I don't have
Mhm.
any problem.
Okay. And do you have any red swelling in the legs right now or any pain in the swelling? Have you noted?
No, no, nothing like that.
Okay. Okay. And are you using any regular medication before the operation in terms of any contraceptive pills or any other medication?
Yes, I'm using just my combined pills for the contraceptive
Mhm.
purpose and nothing else.
Okay. Okay. And okay. And do you have any allergies?
No, nothing.
Okay. So in terms of, is it okay if I called you Amanda?
Yes, yes, it's fine.
Okay. Amanda, I can see that you are here alone today. So do you want some family persons to be with you? Because I'm going to discuss with you a lot of difficult information.
No, doctor, I'm fine. You can talk to me.
Okay, Amanda, I can see that your oxygen saturation is 90. It is down, I mean, it is low, and that you are feeling some problem in your breathing, as well as your rate of breathing is high. So there could be many reasons, but most probably what I get from your information is that sometimes when there is some family history, as you discussed, and also with the use of this combined contraceptive pills, and also after the operation when you are not that much mobile and up and about, so these many factors and associated with a high BMI. Can I know about your BMI?
Yes, doctor, it's 32.
Okay, so all these factors sometimes can lead to the blood become thick and sticky and lead to the formation of a clot. So that clot sometimes get detached and go to the lungs and sometimes go to the brain or heart, which we call as a deep vein thrombosis and pulmonary embolism. Am I clear so far, Amanda?
Yes, yes, you're clear, doctor. Okay.
Okay, so Amanda, what I'm going to do right now is that I'm going to inform my consultant and I will inform also the anesthetist as well as the hematologist. And we need to start you on some blood thinners injection right now. And for that, we will take some investigations. We will do some further investigation in terms of checking your blood counts level, checking the function of your kidneys and liver, and checking the how your blood is clotting. So is that okay with you?
Okay, that's fine, doctor.
Yeah.
Okay.
And Amanda, after that, I'm going to urgently involve the an urgent ultrasound of your legs, as well as the urgent CT scan of your tummy. And in the legs, we will see for any clot if there, and we may need to arrange some urgent CT scans of your chest as well.
Okay, okay,
Yeah.
doctor.
Yeah, and I'm going to talk to the HDU right now, and we'll arrange a bit there. So meanwhile, we will shift you there so that we can have a direct eye on you, and we may need to give you some IV fluids as well. Yeah, some fluids in the cannula. We will pass you some cannula in your hands, and then after that, we will. And as our unit take all these complications very seriously, so we will initiate an incident report form, which means that we will do the investigations that what can we do differently in the future to prevent it from happening. Is that okay with you, Amanda?
Yes, doctor. Yes, I want to know that why my pills were not stopped if they are dangerous for me.
Yes, usually what we can do that we usually stop this 4 weeks before the operation, and because it always leads to clotting, and I will see the notes that where things went wrong and that where things happened that it was not stopped, and then after that detailed analysis we will be open and honest in giving you all the results.
Okay, okay, doctor.
Okay, and after that from the it will take a few days, and then we may need to do run some of the investigation, because in some of the families this clotting problem runs, so we need to continue this treatment of the blood thinners at least for a period of say 2 to 3 months. And then Amanda, to tell you that in the future pregnancies, you need to avoid these contraceptive pills in future as they increases the risk of clotting again. as well as we need to give you some blood thinner injections whenever in the future you get a pregnancy. Is all these are risk factors for becoming the clot again.
Okay.
And right now, I will write back to your GP as well. And before, before your discharge, I will make a detailed discharge plan. I will discuss all the things with you in detail with you, with your partner and your family. And I will document all these in your records. And that I will write back to your GP as well.
Okay.
Is that
Okay,
okay
doctor.
with you?
Yes, doctor.
Yeah.
This is fine.
Do you have any other questions so far?
No, doctor. No, thank you.
Okay. Thank you. Thank you for your time.
Thank you. Thank you, doctor. Well,
Yeah,
you
sorry,
covered very well.
I forget about the examination and all the stuff.
Yes, yes. I'll tell you first. You tell me
Yes.
how was the station?
Oh,
Anything
I
like you
was
know?
like, I was again in exam situation, and I was like again the same thing, that I've totally forget the examination, the chest, the wound, the legs, and
Yes, it
so
happens. This is what we need to practice, right? This is what this practice helps us. This is what the mocks and also the daily practice in the groups will help us, right?
yes.
So that
yes,
making the mistake here is fine, right? Making the mistake in the exam will be dangerous. So it's
Yes.
it's okay. It's okay. Dr. Nasia, otherwise you performed very well. Your like the flow you have, like this you have started very well. Your agenda fixing and everything was very good. Even your information gathering was complete. You forgot to ask about BMI, then you covered it as well. So it was all complete. The information gathering was also very nice. So the coming to that, yes, examination is very important because this time you have this face-to-face exam. So examination is very, very important. And here in this station, particularly, this is very important to examine the chest, the legs as well for the DVT, right? And also to check about the further vitals and everything. It's very important to mention about, right?
Yes. Okay.
Yes. Yeah. And apart from this, I want you to be more sympathetic, like, you know, your voice, your tone, lower down your tone whenever you talk about this breaking the bad news, right? Talk very
Okay.
politely and yes, because you know, if you are monotonous, it will be like you are reading some template or you have, you know, it happens that you are in an exam situation. We don't bother about the tone and everything. We just want to cover the station on time and everything. But you know, work on this. Just lower down your tone whenever you talk about these serious patients who are in very much, you know, distress and pain. So lower down your tone whenever you talk about them. Okay.
Okay.
About the BPN
Okay.
and everything. This is very important. The other thing is that like rest you mentioned about the blood thinning agents and everything. I just need to mention about everything like in the end when you close, then like you mentioned about the follow-up and the future, like if you can mention that whenever she will become pregnant, she need to use this blood thinning agents and everything in the future pregnancies as well. Okay.
Okay.
Yes.
Okay.
Yes, rest you covered all the things. I'll go to the examiner. Okay.
Okay.
So
Okay.
this is the examiner's fee. So you first of all you need to introduce and greet yourself that you did, and you need to ask that whether she's comfortable to talk or not. That you did as well. You need to attach the oxygen, the proper empathetic approach is very important. Agenda fixing, and then only the relevant history is important because you know this patient is very in distress and pain. So we need to ask about only the relevant history here. So you did ask about the personal and family history of clots. The history of this cardiac disease is very important because we need to rule out the MI and everything. So you need to rule out any cardiac pathology. And like you asked about any regular medication, this is important, any known allergies, any history of blood thinning agents, if she's using previously or not, this is important, and the BMI. And then the examination. Then coming to the investigations, we need to go for, this is the station of pulmonary embolism. We need to ask about, tell about the investigations of full blood count, liver function test, renal function test, ECG, chest x-rays, ABGs, and D-dimers and CTPA, all needs to be mentioned in the investigation part that we need to go for these investigations, right? Then then we need to go for the clear explanation and a logical sequence of what exactly happened. Then also I would like to add that you told about this blood thinning agents. We need to talk about something about the enhanced recovery program here, because in case of early mobilization, good hydration, all these general measures are very important to talk about, right?
Okay.
So you can counsel the patient that it's very important to mobilize yourself, take good hydration, you know, to, you know, this is very important apart from the medications. So, and also, you involve this multidisciplinary team, the consultant and the hematologist, intensivist, and all these, because these are in very distress, patient is in very distress, so we need to involve the psychological counselor as well. So you can mention that I can see, Amanda, that you are very, distressed. So if you wish, I can involve the counselor services as well. So, you can involve this as well. This is important. Then this is the applied clinical knowledge pathway that is we need to follow here. After this investigations, we, like you ask about the sign and symptoms of deep vein thrombosis. And if the patient says no, we need to go for the chest X-ray. And if the chest X-ray is normal or not, then if it's normal, then we need to go for the VQ scan. And if it's not, then we need to go for the CTPA. We need not to mention all this to the patient as such, but in a medical, non-medical language, we need to explain her that if we'll go for this chest X-ray first, and if it comes out to be, normal or not normal, then we'll go accordingly, right?
Okay, right.
And explain a little bit about pulmonary embolism, that we are suspecting that we have this clot formation, and this clot can go to anywhere else in the body as well, and this can be life-threatening as well in that situation. Okay.
Okay. Yes.
Yes. So the next is the clinical governance point aspects. You need to talk about this. You mentioned about the duty of candor, debriefing, documentation, incidence reporting, because the COCPs were not stopped before the surgery. So this is right, very right that you did. That incidence reporting is very important, and we need to be open and honest about the complication, use of blood thinning agents, and give her the patient information leaflet as well. And you can talk like this, that I am giving you this written information leaflet. Once you are up and about, you can go. Okay.
Okay. So can we give this information leaflets in such a serious and post-op patient like with a clot? Can we talk about this information leaflets?
Sorry, come again.
Can we talk about the information leaflets
Yes.
in such a situation in which such
Yeah.
a post-op and serious
Here
patient?
your wordings will matter, right? You will say that I'll be giving you this patient information leaflet about the situation that you have, about the condition that you have. You can go through it once you are up and about, once you feel comfortable, like this you can speak. Just to, yes, just to cover this marks of patient information leaflet. Right, and the red flag signs are very, very important here. You missed that, because you can say that in any time in life that you feel again breathlessness or any chest pain, please report to us in an emergency. This is very important patient safety point. Yes, you missed that.
Okay.
And urgent consultant review is important. In the end, you can say that my consultant is on the way to talk to you in a while. Like this, just involve the consultant, and you rightly mentioned about the GP. That was very good. So in a nutshell, in this station, just to summarize, introduction, the rapport building, settling the complaint first is very important, agenda fixing, then information gathering, the focus history and the examination and investigation, then explaining her the condition in a sympathetic manner, performing the duty of candor, and the debriefing her about the COCP that should be stopped, and blood thinning agents to be started. And because her BMI is high, so blood thinning agents should be started earlier, right? So we need to talk about this as well. And then they're talking about the management options one by one, starting from the lifestyle and then towards the medical options. Then the risk management team to be involved, as well as the red flag signs, follow-up to be explained, future management, patient information leaflet, involvement of multidisciplinary team involving the consultant, specialist nurse, counselors, hematologists, all will be involved, and then involving the GP as well. So this is all about this station. So thank you so much, Dr. Nasia. Well performed. Keep practicing. Thank you.
Thank you.
Thank you. Anybody else wants to ask any question? Anyone who wants to ask any question? Any candidate? Or should we wrap up our session?
Yeah, I think it's better, because if there is no question, we should wrap up.
Okay. Thank you so much for all the candidates to participating here in our discussion. Please keep in touch with us in the group. We are posting the task daily. Please do post your audios. We'll give you feedbacks. Okay. Thank you so much.
Thank you. Bye-bye.
Thank you, ma'am.
Take care.
Thank you, ma'am.
Bye.
Thank you, ma'am.